Carly McGahey, and today I'm going to talk about obsessive compulsive disorder, commonly known as OCD. This disorder is a common, chronic, and long-lasting disorder. OCD gives a person uncontrollable obsessions. Some examples of this disorder would consist of recurring thoughts and behaviors that he or she feels the urge to repeat over and over. When most people think of OCD, the first thing usually coming to mind is obsessive cleanliness, fear of germs, having things a specific way, but OCD is way much more than that. OCD can also give a person unwanted thoughts that reoccur on a daily basis or mental images that cause extreme anxiety. Studies have shown that people with first-degree relatives who have OCD are at a higher risk of developing OCD themselves. In some cases, children have developed OCD or at the minimum of OCD symptoms because of physical or sexual abuse during their childhood. But on the bright side, there are a few options for treatment and therapy for OCD. Usually the treatment consists of medicine or psychotherapy, otherwise known as cognitive behavioral therapy. Studies have proven that OCD usually responds well to this type of therapy, typically after being diagnosed with OCD. A doctor will prescribe you to an antidepressant, which are known as SSRIs, selective serotonin reuptake inhibitors. A few different types of medications are fluvoxamine, Paxil, and fluoxetine, commonly known as Prozac. These, though, of course, are just three of the many types of medications that will work for different types of people. It is the doctor's decision, preferably psychiatrist, to decide which medications will hopefully work for you. It is truly a guessing game when it comes to prescribing the right medication for a mental disorder. Obsessive-compulsive disorder is something that too many people make out to be no big deal. But until you walk in someone's shoes that has dealt or is currently dealing with OCD, you really cannot judge. You really never know how medications work until you have to depend on it every single day of your life, and you see how much it has made a good impact on your life since you started taking it. I've been battling with the same disorder for almost 2 years now. At first, when you have no clue what is going on, or much less how to fix it, yes, it does feel like the end of the world. But I can promise you that it is not. There are so many Christian counselors, psychologists, and psychiatrists out there that are willing to help you. You just have to do a lot of research to find the best. The worst thing you can do to yourself is be afraid to reach out to someone and to keep it all bottled up inside. And I can tell you firsthand that it will cause you more trouble. So you just reach out to someone because more people deal with it on a daily basis than you would ever think. Thank you so much, and I hope this video helps you to understand that OCD is a very real thing.